One of the things that governments need to do is to try to force reform through consultations and everything else, but the last thing they should do is keep throwing money into the system, because what that does is it takes away any incentive to reform. And in fact, probably one of the better things that the Harper government did was to say, okay, here's what the provinces get, an escalation of 6%, then it's going to be GDP thereafter. Actually, healthcare costs have been rising less quickly than the 6% in the past several years, so actually the provinces have made a little bit of money on that. But that's not the point. The point is that if the federal government just started giving the provinces more money, and the provinces then just throws more money into the sector, nothing will change. And in fact, that's what's been going on. I think the Martin reform didn't do anything to really improve the system, except they did have some conditions. And so what happened is that we did see waiting times decline in certain procedures, but waiting times went up in other areas, because what do you expect? People are going to say, well, we're going to reduce waiting times for hip replacements and et cetera, but then at the same time, we're going to take resources away from other things, and so what happens, waiting times go up. So we've had, right now, that's why I think one of the things that we need to get is the governments themselves willing to take the horn of the bull and try to redirect it in some way. But the last thing is throwing more money into the system without any required change, because it's going to get eaten up by salaries.